Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk today about two different kinds of periodontal condition, both of which cause bone loss and can endanger the retention or the maintaining of your teeth. The first one is periodontal disease, or periodontitis as we call it. Now that's caused by an infection. Bacteria, parasites get underneath your gum, and these bacteria cause a chronic infection or chronic inflammation, and that chronic inflammation and infection actually gradually destroys the bone around the teeth, particularly between the teeth. And eventually so much bone may be lost, the teeth lose their support, become uncomfortable, and may finally have to be removed if they're not treated. And of course, what's really significant now is that these organisms, these bacteria, get into your bloodstream. They affect virtually every part of your body. Higher rate of pancreatic cancer, lung cancer, heart disease, stroke, and now we're finding a lot of evidence as far as Alzheimer's disease and dementia. Not only is there a link, but I think now a lot of people believe it's one of the causative factors in initiating Alzheimer's disease, because we see a lot more dementia in people who have periodontal disease later on. If you have the infection, one of the most common things that you'll notice is bleeding gums, usually no pain. Periodontitis, periodontal disease, usually not painful. People don't know it. I call it the silent killer. But one of the early signs is bleeding gums, even if it just bleeds a little bit. Gums should normally not bleed. Periodontitis, or the infectious kind, is very common. In fact, over 70% of those over 65 have periodontitis. So it is very common. People don't know that they have it. That's the dangerous part, really. So that's periodontitis, and that's the infectious form of, let's call it, bone loss. Then there's gum recession. Gum recession involves the gums receding away from the teeth, either down or up. Generally, the primary cause is not necessarily bacteria or infection, but maybe genetic. You may have thin gum tissue, which is just prone to recession. You may brush too hard, which may contribute to recession. You may clench or grind your teeth, which may contribute to recession. You may have possibly had the need for orthodontic treatment. Sometimes patients who have orthodontic treatment, it can make that tissue more prone to recession in the future. Now, when the gum recedes, the bone recedes also. So in those cases also, you're not only losing gum, but you're losing bone. And if you lose enough bone, the teeth become loose and they can actually be lost. At any rate, we treat periodontal disease, the infectious kind. We treat that with a laser. Very effective, not painful, works extremely well. The other condition, which is gum recession, periodontal recession, we treat typically with what's called the Pinhole Technique, or the Pinhole surgical technique, which we used to bring the gum up and thicken it over the roots, or bring the gum down and thicken it over the roots. Also very effective. And if you want any more information, I'll have some links below where you can learn about these treatments. So there's two different kinds of gum conditions that we treat, both of which can be dangerous to your teeth, and the first one can also be very dangerous to your general health. If you have any questions, let us know. We'd love to hear from you. Subscribe to my YouTube channel, and remember, if your mouth is healthy, more so than ever, your body will be healthier. Have a good day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.